Assalamu alaikum, students. Welcome to Dr. QT. Let's learn something important today.
Today, we will discuss last part of consent, which is a very important topic of forensic medicine. And in this video, we will cover two important concepts: written expressed consent and blanket consent. 1. Written expressed consent. Written consent is required when the procedure is invasive or carries significant risk. A simple mnemonic is IBEP. I. Indoor patients. Admitted patients. B. Biopsy. E. Endoscopy and invasive investigations. P. Any invasive diagnostic or therapeutic procedure. Remember, every procedure needs separate written consent. What should a proper consent form contain? Think of patient procedure purpose plan people proof. It should include patient, name and identity, diagnosis, when appropriate, procedure, name of the proposed procedure, purpose, why it is being done, plan, alternatives available, people, name of the doctor or surgeon, date and time, patient's signature or thumb impression, doctor's signature, witness's signature. Why is written consent important? Remember, 3 P's: proof, permanent record, protection. It provides proof in court, creates a permanent record, and protects both the patient and the doctor. Example: suppose a surgeon explains an appendectomy, including its risks and alternatives. The patient understands the information and signs the consent form in the presence of a witness. That is valid written informed consent. 2. Blanket consent. Now let's understand blanket consent. Blanket consent means giving general permission without properly explaining the specific procedure, risks, or alternatives. For example, a patient signs a general form during hospital admission without understanding exactly what procedures may be performed. Is blanket consent valid? No. It has little legal value because proper informed consent requires the patient to understand what they are agreeing to. Remember, blanket equals not unlimited. A general signature does not give the doctor unlimited permission to perform any procedure. What if something unexpected is found during surgery? Sometimes, during surgery, the surgeon may discover an unexpected condition. If immediate action is necessary to prevent serious harm to the patient, the surgeon may proceed when obtaining fresh consent is impossible. But remember, BDI. B. Best interest of the patient. D. Document the findings and procedure. I. Inform the patient or relatives afterward. So, the surgeon can act in an emergency when delay could seriously harm the patient, but the action must remain in the patient's best interest and must be properly documented. Final take-home. Remember these 3 lines. Written consent equals specific plus informed plus documented. Blanket consent equals general permission, not unlimited permission. Unexpected emergency equals act in patient's best interest plus document plus inform later. And that completes the last part of consent in forensic medicine.